morning. Good morning, Soukaïna. And good morning, Daniela.
Good morning to everyone who watch us.
It's nice to be here. And very happy to have again Dr. Hennie from South Africa. He's going to introduce himself and tell more about his duty as a doctor and as a producer of a very, very important product for skin. Doctor?
Thank you. Well, I'm from South Africa, and I work with a company called Sakalauskiene Labs. This company manufactures products that has a tremendous influence on skincare and on manipulations of the skin, like we do with Phiremoval. These products consist of hypochlorous acid, which is your immune molecule. It has a tremendous benefit to the skin. It can do a lot around a procedure to make it safer and to make it easier to go through for patients or clients. And I will tell you more about that today. My background is I'm a medical doctor. I trained as a plastic surgeon, but for the last 10 or 11 years, I've been doing research on this molecule, which we also apply in other aspects. Today will talk about aesthetics, but the product also has a huge role to play in the treatment of wounds, and in some way that crosses over if we get wounds in the aesthetics. But we also do research in medicine, in ethical medicine, with a normal process of clinical trials. So the company is widely represented across different fields of medicine and aesthetics. Today, I will talk a little bit about how the product works, how it can be applied in general aesthetics, but more specifically, we will discuss a case that is quite interesting in terms of Phiremoval.
Okay, so nice to have you here because, you know, we have all of the students, they're watching us, and I saw that last time, you know, we had more than 600 viewers, and so you got also a lot of requests about. And I think so that in the future, they can send for us with many interesting cases and we can treat very successful. And we are here to help to our community. So, doctor, okay, can you also now to indicate which cases we can treat with hypochlorous acid?
Well, the active ingredient is hypochlorous acid. It is a molecule made by the white blood cells in the human body. We have two types of immunity. We have an immediate immunity, which helps us in the case of infection or wounds, in this case. And then we have a delayed immunity, which is very much in the news when it comes to COVID-19. The immediate immunity is the most important in terms of preventing infection. And everybody has to go through the process of the immediate immunity, attacking whatever might be dangerous for the human body. And if that immunity is overcome and say, for example, you get an infection, the immediate immunity cannot deal with it, then the delayed immunity will do the rest. We are not dealing with that part. We are dealing only with the immediate immunity and how it can assist us if we have that molecule in our hands to give us better results and safer results in aesthetics. The application of the product is across a wide range of applications in aesthetics, but I can roughly divide them in two groups. There is the immediate treatment support. That product is called GF1. It consists of hypochlorous acid in a specific formulation to assist the skin in recovering from a procedure. And the procedures could be anything that's invasive. In other words, needling, peeling, lasering, and Phiremoval. The GF1 is used around the time of the treatment. It's usually on the first day, but in Phiremoval we extend it a little bit longer. And its role is to combat infection, possible infection. Not always we have infection, but it would prevent it. And its most important role is the control of inflammation. Inflammation is central to what happens in a wound that is created by the esthetician. We've been told for many years that inflammation gives us the result, but it's not so. Inflammation is part of the process which can almost be regarded as a side effect in getting a result. We all need inflammation to start the healing process. But the problem really is that the human body delays the process of controlling that inflammation. And it is not an active delay, it's just that it is a slow process. And that slow process is usually controlled by the white blood cells. So they're very slow in controlling inflammation that was created by an injury. What we do is we accelerate that control on the inflammation. And the result's the same. So in a practical sense, controlling the inflammation gives us, in a sense, an immediate result. So you would have a needling today, and tomorrow you go back to work looking like you've never had a procedure. Because that healing is accelerated, the inflammation is controlled, and no infection can ever happen. Yeah, because hypochlorous acid is such a powerful disinfectant. Now, all of this said is really crowned by the fact that it's so safe. Because if you apply hypochlorous acid by accident in the eyes, it just feels like water.
Yes.
There's no stinging, no burning, no irritation. Yet, it is so powerful that it is far more deadly to germs than alcohol or chlorhexidine or betadine or iodine, the things we use. So you don't have to need to use these things to sterilize the skin before you do your procedure. And immediately after the procedure, you start applying the GF1 every half an hour. And usually by that night, the redness is gone from your face. And of course, controlling inflammation also controls pain. So no pain, no redness compared to what we used to. And that is a modern approach to aesthetics. Safe, predictable, effective, with good results. Now, the other product that Thoclor Labs makes is called GF2. It's a slightly different product from GF1, but it also contains this immune molecule. And the emphasis of this product is that it is a long-term use product. It controls inflammation as well, but a different type of inflammation called inflammaging. Inflammaging is the reason why we get age skins, why we get acne and rosacea and all sorts of dermatitises. And this control of inflammaging is at the center of modern skincare, really, because we know now that the process of aging in the skin is an inflammatory process. We know a lot of things that cause this inflammation. And in the past, skincare has been aimed at trying to avoid those causes. Stay out of the sun. Don't put harsh chemicals on. Don't smoke. Control pollution around you. Those things, we have to control them. But the process, what happens once there has been that stimulus, that initiation, is now we can control the actual process of rejuvenation, of inflammation. And on top of it, hypochlorous acid is also proven to rejuvenate. So it doesn't actually only restore the inflammation, it returns, rejuvenates back to where you were before. So it makes the skin younger, stopping the process of aging and making the skin younger is a fantastic combination. So I think in the future, the whole world of skincare will be very much around hypochlorous acid. There are other things that are also important, and this is the modern trend is to use less products. One of the things we realize now, and it's been suspected for a long time, is that the products that we use on our skins have other effects than what we want from those products. We love the effects of vitamin A and vitamin C and hyaluronic acid, those good things. But the ingredients that come with those products, that's where the problem lies. And in a large way, the cosmetic industry is not regulated to control what goes into a product formulation. And those formulations are governed by things like, will the product last? Can you put it on properly? Will it be too oily, or will it be running from your skin? And in other words, to make the product a workable product, they add things in there that are not really good for our skins. Some of them are recognized now, like the preservatives, parabens, phthalates. They are like liquid plastic. They're not good for our skins. And fragrances, alcohols, and the sulfates. These are things that are already recognized. But I think as time goes on, skin products will have less and less ingredients. And in that way, we can say that Thoklo Labs tries to simplify skincare by giving a single product with many different effects on the skin. And it's a one product that really does all. It doesn't mean that you can't use the products that you currently used to, but the fact that you apply a hypochlorous acid product immediately after cleansing sets the scene for a higher safety profile in all the other ingredients that you add to your skin, because it controls the inflammation that might be caused by them. So it doesn't matter which way you look at it. It is not supposed to replace skincare. It is just there to help. And we use this in a very effective way at the moment. So the future, I think, is very much certain to contain hypochlorous acid. In that sense, we have to also say that not all hypochlorous acid products are the same. It is a new science, and there are methods to make hypochlorous acid that is well known to the industry. You can, for example, make it out of bleach, which is hypochlorous acid in a way, but it's not only hypochlorous acid because it also still contains bleach. Bleach, I'm talking about chlorine bleach. So that's a way of making it. Then you can make it by using salt, table salt. And that is also not such a safe way because, again, the manufacturing process leaves ingredients in that solution with hypochlorous acid that are not safe for you. So the process of manufacturing is also something that holds the entry of hypochlorous acid into the aesthetics market a little bit back. But we've overcome that with our last 10 years of research, and that we can offer a product that is 100% safe and does not contain any bleach or other ingredients or any salt. One of the ways of recognizing that these products are not so safe is to look at the ingredients, and if there's salt in, or if there is sodium hypochlorite in bleach, then you know this is the old way of making hypochlorous acid. And it should be done with great care. I don't think it's nice, even in any case, to put salt on your skin, to use those old products. So we have a product that is pure, with no salt, with no bleach, just hypochlorous acid. And in fact, it is pharmaceutical grade hypochlorous acid. So I hope not too much of an introduction there.
No, it's okay. It's okay. Yeah. I just personally would like to say that I started to use also your products, and I, like, as I said, I get up, and also spray GF2 and go to sleep also doing like that because I like to stop this aging on my face, and I had really very good results. But anyway, if somebody knows me, I had always allergies on my hands because any kind of gloves always cause this, So that's why when I started to use GF2, so all these allergies, they disappear from my hands. And again, I have my beautiful fingers and all the skin. So it's my personal experience. And actually, when someone comes to my room, my working room, of course, I'm using also the spray, and I say, now we are killing COVID because, in our country, very, very bad situation. We still allowed to work, but anyway, we need to protect ourselves and our clients, and we need to use the best and safety products. So I trust your products, and I use, and I am making advertising because I really believe in it. So maybe you like to say something else, and after that we can continue with our special case.
You mentioned COVID. there are three main properties to hypochlorous acid. The first is its anti-inflammatory effect. We talked a little bit about that. The control of inflammation is central to quick healing, safe healing, and a complication-free healing. But the disinfectant property of hypochlorous acid is really in the body, probably its main role is to protect us from infection. So in that sense, Thoclo Labs did a test in the United States on the coronavirus using GF2, and they find that it kills the virus in 2 minutes, completely destroys the virus, and that it does so without any harm to the human cells. So if you want to prevent COVID, we profess that you spray it in your eyes and in your nose and in your mouth, because that's the main entry of the virus into the body. Of course, it does so via the air or via your hands, and spraying the hands also would help to prevent the virus reaching your face. But if it should reach your face, it enters the body through the eyes, the nose, and the mouth. So spraying your eyes and your nose and your mouth, that time that you also spray your skin, will prevent it from getting infected from COVID. And we have used this method in thousands of people, and not a single case of COVID infection was reported. Even in cases where people were traveling in groups, and some of them were using GF2 and the others not, the ones that got the disease were the ones that didn't use it. So we have a lot of other anecdotal cases of nursing sisters working in COVID wards, using the product and not getting ill, despite many, many people being sick around them all the time. So we feel confident that we can recommend it for COVID-19, which during this sad time of infection really is an added benefit to using it.
Thank you for beautiful products. Really, I feel much better and more safety to work with them, actually. Hajer, do you want to say something?
Yes, I'm really impressed and about this product. Our previous live streaming, doctor didn't mention all these about the product, and I'm sure, Graciela, this helped you a lot with your allergy, because I saw your allergy myself, and I saw how these gloves, you've tried many of them, ruined your skin and made you uncomfortable with this itching, and I'm very happy that at last we have something now for our skin, because I also suffer from gloves allergy. Thank you, doctor, for the product and for all this information. This is going to add a big plus to our work, to our procedure, and to Phiremoval Worldwide future. Thank you so much.
Thank you.
And actually, I need a little bit to mention again about our skin, and the hand skin, because we wash our hands 1,000 times, and always with different kind of soaps. But anyway, after this, when I spray with GF2, my skin becomes much more beautiful, absolutely beautiful, because, skin of our hands also aging so fast. And so if you spray this, I feel that very soon I will have very beautiful skin on my hands too.
Yes, and the way through which it happens has also been described through research, medical research. What happens in the skin is that there's a reversal of the aging process. Usually with aging of the skin, which is complicated by, of course, soaps and water and powder from gloves, the stratum corneum, the outer layer, dead cells, outer layer, become thick. And that's why your skin feels rough on your hands. And just underneath that, the epidermis becomes thin with time, because it divides so fast to make dead cells. And that thinning of the stratum corneum, that thinning of the epidermis, makes the skin sensitive. Now, just underneath that, in the collagen of the dermis, it breaks down. So the collagen becomes thinner and the elastin becomes less effective. So you start to get wrinkling of your hands. And then more so, the color-making skin cells called the melanocytes, they start to misbehave and they make these little brown marks called lentiga. So all of those things reverse exactly back to young if you use hypochlorous acid like GF2 on your skin. It's a good reason to do it.
Exactly. And such results I just saw, you know, just after PRP procedures, like now I see on my hands, you know. So that's why I see that, yeah, if we like to compare price for that, you know, it will be big difference, of course, for such. So maybe we can start slowly to speak about complications after all these interventional procedures and how we can solve and how to treat. And so you have big, huge experience how to do it.
Good. I'm going to bring a presentation up. I just have to find it.
It doesn't matter. It's okay. I just will tell for everyone who watch us, you know, that you must not to be hesitate to send us some cases, you know. If you are working, you always sometimes have succeed, you know, but sometimes you have complications and you need to speak with open because we are here to help you. And we have this Dr. Hennie Ross, and he always kindly will advise for you how to go from these situations, bad situations. And sometimes, you know, our clients, they send for you pictures, so you have this proof and you can send us. So we can use it for our not only conversations, but also you can improve everything, you know, what is possible. So
do we see this? What I'm showing now? Sakalauskiene Labs Effective Solutions. Can you see that?
Yes.
Good. So just to recap quickly, the important benefits of having hypochlorous acid, as you can see, is to control inflammation. And that is around the procedure, immediately after, and long-term, of course, for different benefits. Then the control of pathogens and the control of healing. Now, in terms of fear removal, I think it's important that we look at how this benefit of hypochlorous acid can be applied. I have here a slide showing a test that was done. In the area of the blue circle, you can see in both of these cases, on the left and right side, a small bit of the epithelium was removed from the skin, and then a little glycolic acid peel was done on that. So in the left slide here, there is an intense inflammatory reaction happening. This now remember where hypochlorous acid GF1 was not applied. And on the right-hand side, you can see where it was applied. So there is the sign of the peeling, the sign of the area of deepithelialization, but very...
Dr. Hennie, I like to interrupt. I think so we are looking main your presentation, but not this case. Yeah?
I'm not sure I understand. What did you mean now?
So we now we see hypochlorous acid antiseptic effects, right? But we don't see any pictures.
Oh, I see. Let me see what
Okay.
that could be the case. Let me try something else.
But actually, you can also, you know, to repeat this presentation. This presentation is excellent, you know.
Yes, I will just... so while I'm looking for it, I just want to tell you that this particular case that we're talking about is where a trial was done to look at what is the difference, because with fear removal, I know that we work with glycolic acid. So
yes, fear removal is based on glycolic acid, yeah.
Yes. So the procedure was done to try and show what is the effect of using hypochlorous acid in the environment of glycolic acid. And I wonder if you now see the picture in front of your screen.
Yes, we see.
All right. So you see here is a blue circle.
Yep.
And this blue circle shows an area of inflammation that was created by de-epithelialization of the skin and then putting a glycolic acid product on top of that. And on the other side, inside the blue circle, is an area of de-epithelialization that does not show the same swelling as on the other side because hypochlorous acid was applied. It is just a sign of how hypochlorous acid controls the inflammation. Now, there is a reason why I show this. And I think we can proceed to the slide that Master Ella supplied me with some clinical pictures. And can you see this now?
Yes.
The picture that you are well aware of. So I have taken 6, thank you for sending me a whole series of pictures, but I've taken some pictures out of that to make, to show certain things. So here is a case with a fee removal that will be done on the brow area. And this is before the procedure, and this is immediately after the procedure. So what we see immediately after the procedure is already the first signs of inflammation. You can see here, there's red. There is also edema starting, swelling underneath here. And it is an area that shows acute inflammation. Now, it could have been much more, it could have been much less, depending on whether you use hypochlorous acid. But there is always inflammation when a procedure is done.
Sorry, I will interrupt you because usually we don't see such inflammation immediately after. So it comes a little bit later. So in this case, for me, it's a little bit unusual.
Yes, so we have to think why. So the reasons why I think it could have happened is either from the procedure side or from the client side. The client could be a hyperreactive inflammatory response person with just a very acute inflammatory response, and we see that. Some people show a different reaction, for example, to being stung by a bee than other people. This is because of the speed and the ferocity of the inflammatory response. In this case, we probably have a very acute reaction to the glycolic acid, which is not the fault of the glycolic acid, but the patient is just, or the client in this case, is just that type. You can also see here how in the inflammation causes swelling already, and this is just minutes after the procedure. So in this case, we have a clear indication of periorbital swelling. Here, it is really a lot of swelling, and it's unusual. I agree with you, and it is almost like it is swelling. You can see how broad the nose is here. The redness is well under control, but there is edema, swelling, and this is due to something specific happening in the body. Let me go and show you why swelling happens. Why is there swelling around a wound? What happens in the body? The first process is inflammation. And this happens because of penetrating the skin, introducing a chemical into the skin, whatever the reason, there is inflammation. And that inflammation leads to something called bradykinin production. Now, bradykinin is the follow-up of inflammation, which leads to vasodilatation. This means small blood vessels dilating, and they increase their permeability. That means they start to leak. So they dilate and they start to leak fluid out of those blood vessels. And this leads to, first of all, wound fluids, if it's an open wound, or just swelling. Now, this reaction of inflammation, bradykinin production, in this particular case, is an acute response, which is probably her immune response. So we need to be able to deal with it. We need to be able to know what is this process that happens. And this is where we can start to feel very comfortable using hypochlorous acid, because look at this. These are the things that hypochlorous acid have been published in medical journals. Here are the publications talking about what happens when you apply hypochlorous acid to skin. First of all, it blocks something called nuclear factor kappa B proteins. This is like telling the messenger to go and activate the genes of inflammation. So it stops that messenger from going to activate the genes that cause inflammation. Then it blocks the gene that is responsible for inflammation. And it's published in the medical journals. Here it is. So you stop the messenger and you stop the gene. If there is some release of inflammation messengers after that, we call them cytokines. You must have heard the word cytokine storm in COVID. These are released by the gene if it gets activated. And these things are also neutralized. And the most important thing here is in IL-6, it's called interleukin-6. This is a messenger that causes the havoc that we see as inflammation. And then there's other things that happen as well. But then the inflammatory response, that response, which is already blocked by hypochlorous acid, goes through this process in the human body, which is called the bradykinin system, which is the process that actually dilates the vessels and makes the leakage into the wounds, that causes that redness and swelling. Now, there's a whole process here. This is academic. It starts with something called prekallikrein, kallikrein, kininogen, activated bradykinin release, and then this bradykinin connects with a little receptor in the blood vessels, and they dilate the blood vessels then. So all of these red lines is where hypochlorous acid blocks the process. And this is how we can, to a large degree, prevent that swelling if it happens. And that brings us then back to our case here. And this is the process that happened afterwards. So at 5 days, there is quite a lot of swelling here happening. And then at 10 days, there is starting to show some eschar, we call it in medicine. It looks like a necrosed skin that could be the result of concentrated glycolic acid or just a very severe inflammatory response. I think it's a combination of both. So there is now some skin starting to lift off here at 10 days. And you can see now by 10 days that it looks like the swelling is getting under control. That's much less than here in under 5 days. So the whole process is starting to separate here. And here, when we get to 11 days, there is already lifting up of this area here. It's all perfectly normal, these things. We are very well of these things that happen in medicine. They happen all the time. All we need to do in Phiremoval is to realize what is going on. It's nothing to be afraid of. It's nothing to be panicking about. It's just realizing. If you have the knowledge, you can be calm because you know what is going on. So here is now this skin coming off, and it's now exposing the underneath tissue here, which now we don't have later photographs now, but this is now also going to be treated with GF1, and it will heal very satisfactory, provided, and this is the key thing, provided the GF1 can be in contact with this. Now, this brings me to an issue, and that is, how can we get the GF1 to be in contact, or how can we try and prevent things from happening? And for us, it's very much a learning curve, like it is for you with our product. We also did not have much experience with this fantastic procedure of yours, so we are learning as well. We know from our experience in medicine, in treating wounds, that the longer you have contact with a wound, the better the result. So, to take it broadly, if you do a dressing on a wound and you do it only twice a week, it will be better to do it 3 times a week, and it will be the best to do it every day, because the contact time between GF1 and the skin or the wound is more. So if we look at a practical application here, how I start to see things happening, if we see an inflammatory reaction like that, In retrospect, I'm not saying it should have been done, but in retrospect, we should teach the students to put a dressing on here, a small gauze dressing that contains hypochlorous acid from GF1. So you wet that little gauze dressing and you put a little plaster over here, and this wound stays wet because you now have seen a very strong inflammatory response, and send your client home with 2 little dressings in this case, or wherever you've done the procedure, whether it's in the lower leg or on the arms or hands or whatever, it doesn't matter. So put a wet dressing on and send them home, and let them keep that dressing on until the next day, when they must come back to you so that you can see what's going on. If you then see the next day that there is still a reaction, then you have to repeat it. And you have to tell your patient or your client that this is to control a process that would make it more comfortable for them. So controlling the inflammatory response will give them greatly more comfort and release the bradykinin response, which is happening in that skin, which is causing the swelling around the eyes, and which is causing the intense inflammatory response. So controlling that is best done with small dressings, and here it is your job to inform your client so that we have compliance. In other words, they have to do what you tell them. It's much easier to just spray the product on and to do it every half an hour. But remember, this procedure of spraying it on works very well if we are going to treat something like needling. Let's look at this case. So you do, let's take this case. So there is intense inflammation from doing a mesodermal treatment. You spray it on every 15 minutes, and 90 minutes later, it's already getting under control. And here is a case of 18 hours later, it's already under control from dermal needling. But if we are going to do an invasive treatment like fear removal, it's a slightly different thing, because we introduce a chemical into the skin that lifts the pigment out. And that chemical has a reaction to the surrounding tissues. And this is the reaction that creates this intense inflammation that we have to control. So today, I know already much better than the last time I had a discussion with you on a live stream. And I can say that I am convinced that a little dressing that keeps the wound moist will be far better on that treated area. And if you can imagine a dressing that stays wet for a couple of hours, how many times more of contact it gives to the skin than just spraying it every 15 or every half an hour. That is a very short contact time compared to a dressing. So what can we expect from this? We can expect that that area will, of course, lift off, and all this will lift off. And if we can get the dressing on, it will take only a few days, maybe 4 or 5 days, if we can get the client to wear a dressing to heal this. There is also the benefit of hypochlorous acid leaving no scars or very little scars in a wound, which is a very big comfort. But this is again is depending on how often the wound is wet or how long the wound is wet. So dressings are far better than spraying. And if you have a light response, yeah, you have to learn that spraying will give you a good result. But if you have an intense reaction like this, my recommendation is to use dressings.
Doctor, I have some questions, So actually, this case is for us is very good example. And when we start to think how this color starts to lift to the surface, So fear removal always destroys these pigment layers, and makes this substance always very thick, and skin doesn't like what is thick inside and always pushes to the surface. But anyway, when we get all this crust, and for example, we need to speak about dry healing now at the moment, because for us, very important to understand what is dry healing. Actually, it means, I think so, no ointments, any ointments, yeah, actually, yes or not?
Yes, thank you for reminding me about that, because we spoke about it in the week. There's this classic belief that, and I almost want to call it an old folks' tale, that putting a petroleum jelly or an ointment is good for your wound. It's not good for your wound. There was research done at the University of Leeds, I think 2 or 3 years ago, and this showed something very interesting. If a wound is left to heal just by the fluids that it secretes, that healing is much faster than when you apply a layer of petroleum jelly or ointment, for that matter, because it's essentially the same thing. An ointment just has some antibiotics in it, usually. So why? Because for a wound, ointment is like putting a drop of soap in oily water. You've seen when you do your dishes, after putting the dishes in water, there's a layer of oil on the water, and in the moment you put a drop of detergent in that water, it breaks it up, and that the surface, the oil just disperses. Now the healing factors that come to the surface of the wound to start the process of mending is disrupted, like oil is disrupted by soap. And the recommendation is stay away from ointments. Now, I would recommend that we follow that principle also when it comes to fear removal healing, because it is in essence a wound that we create. And we should have more and more the thinking of medical approach to this procedure. I don't say it because I'm a doctor. I'm saying it because the studies and the publications and the peer-reviewed work done on this is clear. When you have a wound, there is a certain process to follow if you want the quickest and best healing. And hypochlorous acid is perfectly suited to this whole process of published work. And it's clear in the medical profession that that is the way to go, and not with ointments.
So we need to forget antibiotic ointments, right?
Antibiotic ointments have actually been out of favor for quite a few decades already. I remember when I was a student, they told us that is the principal cause of antibiotic resistance is antibiotic ointments. Whether that's true, I don't know, but I've never believed in them because I've never seen them actually work very dramatically. I find much better results than putting ointment on just by using GF1.
Okay, I think so that today you answered to many questions, and yeah, some parts sometimes is difficult to understand for someone who are not, they have no background, medical background. But anyway, if they will contact me, I will explain everything in much more simple way, because we are partners in this case, when we discuss about fear removal. And so I just want to make everyone sure that we understand what we like to advise today, and that dry healing is much more better and much more faster and much more safety as healing treated with ointments.
Yes, I have to say that you have a brilliant understanding of the process of wound healing. I'm very much impressed by that. Thank you. It's very nice to work with you.
But actually, we always will be close to you because we need such brilliant doctor in our fear removal field, and all this community was waiting for such a moment to have such person in our community. But anyway, so I think so that we will have more live streams with you, and we will have more cases, and we perform this procedure not only on the face area, we perform this procedure also on body area, different areas. And so if you work with fear removal based on glycolic acid, we have really sometimes very different healing anyway. But principles, of course, we are always the same if you treat very well. Anyway, I will send you, and my students, they have also some questions, if you are able to answer, if you have time for that.
I love getting questions. I love helping wherever I can, and please send your results. We would very much like to use that to teach ourselves more and learn more for all our benefit for the future.
Yes, I will send you my suggestions, because yes, I have so many thoughts in my head now at the moment, you know, when I see all these cases, and I just want to help to all our community, you know, to grow up and to make this procedure so safe as it possible.
Thank you.
So thank you very much for beautiful conversation. And Hajer, also maybe you like to say something for us at the moment.
I am speechless. I have no word to express. You know, even to ask a question after all what Dr. Hennie said. I am really like big wow. I'm so happy about this product. I am really happy to the extreme. I cannot wait to have this product in my Arabic Tunisian community. It will be a big help because we have a lot of cases all around, not only Tunisia, even in North Africa, people who are working with Phiremoval and many other procedure in PMU. I would love to thank Dr. Hennie 1 million times, not only one time, because really you are opening a successful doors for all Phiremoval artists and professionals and other PMU people working in that field. Thank you many times, Doctor. And,
thank you. Thank you for asking me. And remember that we are in need of distribution. The product is registered for use. We very much would welcome anybody that can help.
Yes, I would like you to tell me now on live. I would love to have the exclusivity for North Africa.
Yes, if you have the ability to distribute, of course. We would be very happy to talk to you.
I have your word, huh? It is on live.
Absolutely.
Yes.
I think so also that our doctor will be most popular person during our conference in Nice. I believe.
Yes, I'm waiting for that. I hope the virus will leave us alone now that we can carry on with our business.
Yes, exactly.
We're looking forward to that very much.
Okay, I know that
in our Congress, Dr. Hennie will have many fans now. We will find him with many people, you know, asking question, taking photo with him, because he's giving us a miracle about all this problem we have in our work, and especially for aftercare. I'm very happy about that bit of aftercare. In Phiremoval, aftercare is very important for us.
Yes.
Okay, Hajer, I know that doctor hasn't many times to talk about, and so we need to finish right now. He's very busy. Yes. So thank you very much, and we will invite you again, and we will prepare for you many interesting cases, and we will develop everything together.
Thank you. It's very nice to have the opportunity to talk to you. I appreciate it. Thank you.
Thank you very much.
Thank you, Doctor. Grandmaster Ella, I am really, wow.
Yes, really, we are happy, because we also move forward, you know, together with really such great products. And for us, aftercare always was very important. And everyone who is doing also fillings procedures, we need to take attention that they need also to be prepared for many unusual cases, you know. And so everyone who is working sometimes has really such cases, and we need to know how to deal with it.
Yes. And thanks to you, it is you who have chosen this amazing doctor. Really, bravo, Grandmaster Ella, bravo.
Okay, dear. So our next live stream will be with, as I told, from great organizer for many events from Pakistan, Hajer. And so he will prepare for us also many interesting conversations during this live, and see with you. I hope so to have it on Friday.
Super. This coming Friday. Okay.
Yes.
Looking forward to. Please don't go away. I need you just for a very short while.
Okay. Bye-bye, everyone who watched us.
We will see you soon on Friday with a new guest from Asia. Okay, bye, and I wish you a wonderful day full of joy and happiness. Bye, everybody.